Residents of the Datu Paglas town in Maguindanao were evacuated as government troops drove away members of the Bangsamoro Islamic freedom fighters who stormed the town yesterday. Over 2 million Filipinos have been inoculated since the government's vaccination plan was first rolled out in March. That is just 3% of the government's target for herd immunity. In a bid to wake local tourism from its slumber, the IATF has allowed air travel from the NCR+. But there's a catch. You can only fly through a chartered flight straight to your destination. Meanwhile, the health department announced that the country will be beefing up its border controls to keep out the COVID variant first detected in India. And just in time for Mother's Day, a group of women's rights advocates launched an online flower shop that highlights the true value of a mother's work. Fast, focused, and fearless. Here's everything you need to know as you jumpstart your day this 9th of May, Sunday. I'm Charles Lejano. Government troops drove away members of Islamic State-linked Bangsamoro Islamic Freedom Fighters, or BIFF, from a town in Maguindanao yesterday. This after a firefight erupted between state forces and the BIFF at the town market early yesterday. Members of the BIFF were reportedly camping in the market, inciting fears of another siege similar to that in Marawi in May 2017. Major General Juvimax Uy, commander of the 6th Infantry Division, said security forces secured the market and the entire Datu Paglas town at around 6 a.m. He added that the crossfire did not result in any civilian deaths or damage to property. Uy also assured the public that the situation is manageable and that the government is on top of the situation. Over 2 million more doses of AstraZeneca vaccines arrived in the country yesterday. According to vaccine czar Carlito Galvez, around 525,000 of these will be distributed to various hospitals in the metro, while the remaining will be distributed to highly urbanized areas across the country. This is the second batch of AstraZeneca jabs to arrive in the country through the COVAX facility, in addition to the 525,000 doses that came in March. Meanwhile, the health department says over 2 million Filipinos have so far been inoculated since the vaccine rollout began in March. This amounts to 3% of the government's target of 70 million, which is needed to achieve herd immunity against COVID-19. Of this number, 1.8 million have received their first dose of COVID-19 vaccines, while only 372,000 Filipinos have so far been fully inoculated. The government has received a total of 7.5 million COVID-19 vaccines, including those procured by the government and those donated by China and the COVAX facility. Nearly 7,000 new COVID-19 cases were recorded yesterday. This brings the country's total caseload to 1,094,000, around 63,000 of which are still considered active cases. 170 more people died from the virus overnight, pushing the death toll to over 18,000. Meanwhile, total recoveries now stand at 1,013,000, after 10,000 more recoveries were logged yesterday. Newly minted PNP chief Guillermo Eleazar says violators of minimum public health standards should not be physically punished. As Eleazar took over the top post in the police force, he reminds police officers that they may only arrest violators, but are not allowed to impose any other forms of punishment. Eleazar adds that making violators do physical exercises is a form of prohibited punishment, and stressed that only the courts or the local government units can impose penalties. And these remarks came after President Duterte ordered the police to strongly clamp down on quarantine violators such as those not wearing face masks in public. The IATF has allowed point-to-point travel for residents from the NCR Plus bubble, but only through chartered flights. The government classified air point-to-point travel into two kinds: direct point-to-point and point-to-point with short transfers. Tourism Secretary Bernadette Romulo Puyat explained that residents would need to book round-trip chartered flights from an airport in the bubble to a hotel or accommodation establishment in their chosen destination. Those opting for short transfers will also have to book chartered flights, but will be allowed to take private land or water transfers. That's as long as the transfer service is owned by the traveler or otherwise offered by the establishment accommodating their stay. The DOT also said guests will not be allowed to go through a public transportation hub or commingle with travelers who are not guests of the same accommodation establishment. Stricter border controls are being implemented in the country in a bid to contain more infectious COVID-19 variants, such as the one first detected in India. According to Health Undersecretary Maria Rosario Vergere, travelers entering the country will be required to undergo a mandatory 14-day quarantine. 10 days will be spent at the government quarantine facility at the national level, and the remaining 4 days will be spent at local centers. On the 7th day of quarantine, travelers will be tested for COVID-19, but regardless of the result, they will have to complete the set quarantine period, and these new rules apply regardless of whether the traveler has been vaccinated or not.
Magpapatupad na ho tayo na mas stricter na border control kung saan lahat ho ng papasok ngayon na travelers would be subjected to a 10-day quarantine at the national level with testing on the 7th day. And then kapag katas ng 10 araw, tsaka po sila i-endorse sa local governments for completion of the 14-day quarantine.
Meanwhile, most people who contract COVID-19 will only experience mild symptoms and can recover in their own homes. But what is the standard treatment protocol if you have COVID-19 and are caring for someone or yourself at home? The World Health Organization tells us in this video.
If you're caring for a COVID patient at home, what is the treatment protocol? Hello, I'm Vismita Gupta-Smith, and this is Science in 5. Talking about how to care for a patient at home, the treatment protocol for COVID-19 care at home is Dr. Janet Diaz. Welcome, Janet.
Thanks for having me on this important session.
Janet, please explain the treatment protocol for COVID care at home.
So if a patient with COVID-19 is going to be cared for at home, there are a few important things to consider. One is the patient should be in isolation, meaning that we don't want that patient to transmit the virus to other people. Number two is you may have a fever. So if you have a fever, you can take symptomatic treatments or antipyretics or drugs that reduce fevers to keep you comfortable. So that's okay. The third is to eat and drink sufficiently, so make sure you stay hydrated, make sure that you maintain some good eating habits, eat what you like, but ensure to keep yourself well-nourished and well-hydrated. Most patients who get COVID-19 will have no complications from it acutely, may not develop severe pneumonia, may not need to go to the hospital, and that's good. But we do know there are a few patients with mostly those who have risk factors for severe disease. These patients are at risk for developing severe disease. So these patients, if they're being monitored at home, need to carefully watch your symptoms. There's one thing I do want to emphasize. SARS-CoV-2, we know, is a virus. So if you have COVID-19, then in patients that are being managed at home, we don't recommend the use of antibiotics. That means medicines that treat bacterial infections because it's a virus infection, so it won't respond to an antibiotic.
Janet, we are seeing an increased demand of medicines like remdesivir and also increased appeals for plasma therapy in the treatment of COVID-19. Please tell us what the evidence is telling us about the effectiveness of both remdesivir and plasma therapy.
At this moment in time, we have a recommendation against the use of remdesivir for patients with COVID-19 because there was low certainty in the evidence that it had any benefit in mortality. For convalescent plasma, we don't actually have a recommendation in that guideline specifically yet, but what we do have in the clinical management guideline is also against its use unless under clinical trials, as evidence is accumulating on those interventions. So we also do not recommend its use other than under clinical trials, which are continuing and ongoing.
And for Mother's Day 2021, a company in the U.S. launched the Moms Deserve More flower store, an online campaign highlighting the true value of a mother's work. Let's watch this.
Look, we've been celebrating Mother's Day for 107 years, but this year's different. And we say, keep the flowers, keep our card, What we need is to value mothers' labor. We're tired of working for free. We're tired of being America's social safety net. And so give us the things that we need. Value our unpaid labor. Give us affordable childcare. Give us paid leave. Give us support for our mental health stress. And so we created a Moms Deserve More flower store to call attention to the things that that moms are facing today.
Okay, so for the biggest bouquet that's available on your website is $800 billion, and that's for the unpaid work bouquet. That's a pretty big number. Walk us through how you got that number. Unpack it for us.
So $800 billion is a stat that Oxfam came up with this week, and that was a total value of income that mothers across the globe lost because of the COVID-19 pandemic and having to either lose their job or to stay at home to do unpaid labor.
The Biden administration last week introduced its American Families Plan. Do you think this plan addresses some of the issues, investing in childcare, for instance, paid family leave, in a meaningful way?
Look, it's a start, and I think if we put America's families first, we put America first. And so we're all, pre-K education, something that we need, paid sick days, affordable childcare. I'm the daughter of refugees, and I was a latchkey kid because my parents couldn't afford the $50, a week for childcare. And so many moms, our labor market participation is back where it was in 1989. We lost, 30 years of progress in 9 months. And so we have to fix the social, the structure. But what I would argue is that we need more than legislation. We need a national reckoning, right? That is basically providing the value for so much of our unpaid labor. Here's the thing, Scarlett. When we think about why we don't have gender parity in the workplace, it's not because we need another mentor or another sponsor. It's because we're doing 86% of the unpaid labor at home. And so we don't have the energy or the time to raise our hand for that promotion. And we just have not valued this work in America. And it is distinctly an American problem.
Right.
$26 billion that we're going to spend on Mother's Day, $26 billion on cards and flowers. I think that this Mother's Day, we need to rethink motherhood. We need to think about all the dreams, all the resources.
So I want to ask you, because obviously the online flower campaign is a very effective campaign, but I'm curious as to what the long-term strategy is here for parts of the Marshall Plan for Moms to come to fruition. Is there a blueprint for a social movement of the size that you're talking about? Do you look at, say, the 20-year battle to achieve marriage equality as a successful case study here?
I do. Look, I think that we're building a national movement to put moms at the center of recovery. I want to shorten the economic recovery for mothers. And this is a plan to do that. And that includes passing legislation. It includes changing social norms. And it includes, working with the private sector or pushing the private sector to make sure that when we invite mothers back to work, that they don't face the motherhood penalty, that we can actually thrive. We have to reimagine motherhood in America today. We're going to do that with the Marshall Plan for Moms.
And that's how this year's Mother's Day is shaping up to be. Join us again later at 10 a.m. as we monitor the day's biggest stories from sunrise to sundown. You can also catch One News on Signal Play. Register for a free account at www.signalplay.com so you can stream One News live anytime, anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.